I thought first you could just begin by introducing yourself and maybe telling us a little bit about how long you've been in practice for as an occupational therapist.
Sure. Um, I went to Xavier University. I got my master's there, and I started in neuro acute, went into neuro inpatient rehab, and now I'm in neuro outpatient. I've been in OT for about 9 years, in neuro that whole time. So the current clinic that I'm at, Marquette Neuro Recovery Clinic, is a little bit different model. We offer private pay intensive wellness options and traditional insurance-based care. So that's where I'm currently at right now, and I've been here for just about 4.5 years.
That's awesome. And that was one of the things that I know as an occupational therapist myself by background, I was really excited about your clinic because you offered a lot of different programs and models of care, just for different client needs. So, would you mind just saying a little bit about what your job is like as an occupational therapist? What do you do?
Sure. As an occupational therapist, I look at all of the daily activities that people are doing and trying to improve their independence. So, a lot of our clients have different neurological diagnoses. So, majority have spinal cord injury, traumatic brain injury, stroke, um, and a little bit of MS and Parkinson's. So, on a day to day, depending on the client, I could be working on return to daily activities. So, that could be something basic like dressing or going to the bathroom on your own, or all the way as higher level as grocery shopping or driving again or trying to return to work. The other big part of what I do is upper extremity rehabilitation. So with those neurodiagnoses, a lot of times there's some degree of paralysis, whether hemiplegia from a stroke or tetraplegia from a spinal cord injury. So doing a lot of upper extremity rehabilitation, especially at our clinic with our intensive program. We do an upper extremity intensive program, and that's at least 4 hours a week for multiple weeks of just upper extremity rehab. And that can be offered to any diagnosis that needs that. So I've had patients come for 3 hours a day, 5 days a week for 12 weeks. And I've had some patients come for 2 hours a day for 3 days a week. It just depends on the
Yeah.
severity of their issues.
I guess I'm wondering what drew you to this particular kind of career? Did you always kind of feel in your heart and soul that this was something for you?
I originally had started in education, moved into psychology, and then moved into anatomy and really, really loved it. And then found occupational therapy. Within my coursework, I also really enjoyed taking neuroscience and neuroanatomy and just learning about how the brain works. Um, I'm a big people person. I always knew I wanted to work with people. I didn't know with what capacity, but helping people, interacting with them, and being a part of the solution is something that's really important to me. People will say, "Oh, that's so sad that all these stories you hear every day," and I just say, they're going to happen regardless. At least I can be a part of the person's end goal and help facilitate their independence and activities that are meaningful to them.
Absolutely. Thank you for that. It just got me thinking about all the different challenges that you observe people having. Can you just provide some of the common challenges, maybe impairments, limitations, uh, touching a little bit on upper extremity conditions would be also helpful for our audience.
Sure. Within the neurodiagnoses, a lot of motor deficits, obviously, with the upper extremity function. But then on top of motor deficits, it's always compounded by something else: limited sensation, decreased cognition, impaired proprioception. Could be a motor planning issue, visual perceptual skills, and all of those factors really contribute and impact the rehabilitation. So it's not just as simple as a weak muscle. And I always tell my patients this: the issue is that there's been a disruption within the flow from the brain. So that can control anything. So the stroke could have impacted so many different things, causing aphasia that make the rehabilitation process a little bit more challenging. And then I just think on top of all of the motor deficits that we're dealing with, we're also dealing with a lot of comorbidity issues that are now existing. Something as basic as decreased activity tolerance. The person's not as active as they were before. With that loss of independence, oftentimes comes depression or anxiety. And so those factors really play into the rehabilitation process.
Yeah, absolutely. And, you know, when I think about neurorehabilitation, we're often talking about the patient, the client, that's sort of the center of everything, but not far from that individual is their loved one.
Mhm.
Stroke does not just impact the individual that had the stroke. It affects so many people around them. So I guess what in your daily practice, tell me just a little bit about the relationships you have with family members and the care providers that, you know, attend the sessions or that need information on how to provide adequate home support and a home program for these folks.
Sure. I think going from inpatient rehab into outpatient therapy, inpatient rehab, you're with them every day, you're driving their care. And outpatient, you do so much case management,
Mhm.
and making sure that the individual is trained. The individual knows the best way to help facilitate their independence, but also keep them from getting frustrated, but also still support them. That's really hard when you have a family member that's helping you, because your first instinct is to want to help. So
Yeah.
involving them within that session, providing education on the way to help maybe isn't to help, or
Right.
maybe you help at something else. And I think that's a very hard concept for people to grasp. The other thing is that these individuals are going through it. There's so much loss that goes on with the actual patient, but then to transition from being a spouse to helping someone with their toileting needs and
Yes.
becoming a
Yes.
caregiver, to whole role shift in dynamic. And I just really create a collaborative relationship between everybody just by having open discussions, not just always telling them what to do, but also checking in. Are you doing okay? Or offering them a coffee or a tea. Like, I want them to feel supported as well, and opening up the line of communication. Is there anything this individual could do that would be easier for you?
So what type of patients do you think would benefit from using the Ipsy hand?
In my clinical experience, I feel like there can be a vast amount of motor function levels of clients who would benefit, all the way up from coordination issues. I was using it for people with poor proprioception and sensation and fine motor issues, and then with patients with severe hemiplegia. So I think a lot of patients benefit from using it. It doesn't just have to be something that only severe hemiplegia or higher level functioning. So it's really dynamic in that way. Um, One of the big things my patients and clients ask me is what the insurance coverage would be and how can they get this device for home.
Yeah. Well, I actually have groundbreaking news, Rose, that I haven't even shared with you yet because it is so fresh and hot off the press. But CMS, the Centers for Medicare and Medicaid Service, actually established a new healthcare common procedure coding system, which is called a HCPCS code. It's a level 2 code for the Ipsy hand.
That's
So,
awesome.
yeah, so this is a significant decision. And it marks the first time brain computer interface controlled therapy has ever been recognized with the receipt of a HCPCS code. So it sets a new benchmark for thought activated control devices like the Ipsy hand.
Mhm.
So effective early April, we have a code E0738 that's used to describe the Ipsy hand rehab system because it provides assistance to facilitate muscle reeducation, including a microprocessor, all components and accessories to describe the Ipsy hand upper extremity rehab system. So what all that means is that there is higher likelihood now that your patients may have a portion or all of insurance cover it. So what we are doing is we are effectively starting now gathering insurance information from individuals who are interested in finding out if there's part of the sorry, let me see. So that right. So right now we are collecting insurance information, and we have documentation prepared and ready so that we can support the medical necessity for IpsiHand system for use in the home. So we understand that this is going to take some time to vet out, and we will have to see how it all comes through. But we are very optimistic that insurance will cover all, if not some of the IpsiHand. Can you just share a little bit about how you measure progress, or maybe said another way, how do you celebrate wins for people?
I think that doing a subjective measure is huge and rating the patient on, well, having them rate themselves on an activity that they're able to do. And then being able to reflect on that and go back and say, wow, that is so much better. You scored yourself differently on that. That's aside from all the objective measurements that we just need to take, you know? And
Yeah.
I think that working with them and really getting their goals, they're so much more motivated, and then they see their progress. And it's so exciting when they come in and they're excited to share something with you.
Yeah.
And you're not the one being like, you're doing so great. They're the ones telling you how great they're doing. And that's what's really rewarding. And you feel like, okay, I'm doing what they
Yeah.
needed because I'm just kind of the vehicle to take them where they want to go and direct it.
Yeah, absolutely. So speaking of rewarding, I know it might be hard to think on the spot and without naming names, but can you think of any examples of individuals who have maybe lost hope but then made exceptional progress through the efforts that they made at home and also through the skilled care that you provide? I know a lot of our audience has suffered a neurological injury. Many of them have had a stroke, and they've been frustrated with lack of progress. And I'm just thinking that this might be something that would be encouraging to them if they could hear about others or stories, maybe through your words of what you've seen by getting help from an occupational therapist.
Sure. Just recently I had an individual and she did our intensive program. She was 12 years post-stroke, and we hit it pretty hard, and we did a lot of repetitions of movement and a lot of goal-directed practice that she was picking out. And at the end, she was able to write her name with her affected side, which sounds really basic, but she had written a handwriting book in the past and
Oh,
done like lectures on it. So handwriting was something that was really important to her. And when she finally did it at the end, 12 years after a stroke, she was super excited and tearful and emotional, and it was pretty awesome. And then the other day I had a individual who is 3 years post stroke, and he came in and told me that he was able to feed himself with his right hand for the first time, and it was still messy, but he was really proud of himself. And then the next day he came in and said he was able to shave with his right hand. So he's been doing all these different functional activities and trying them at home, and
mhm.
then coming in with all these new things that he can do. And I think just as science progresses and medical technologies progress, everybody out there who has a neurological diagnosis should know that there's new opportunities, there's new technologies that are available, like the IpsiHand, to try and see if it can make a difference. Because that whole thing they used to say about you get what you get within a year is proving very much not to be true. And what if we give you different things to support neuroplasticity in your recovery, and just be open to trying all those things?
Absolutely. Yeah, thank you for that. And I just reflected how you and I met in the first place. You found out about the IpsiHand because you were proactive. I don't remember if a patient brought it to your attention or if you saw it on the website, but whereas, some therapists might not be inclined to do the reach out to the company, you did. And we got on the phone like right away, and we just had amazing conversations about neuroplasticity and progress that individuals can make if they're pushed and challenged, and we really work the brain. I'm just curious, how do you stay updated with all the different trends going on in neuro rehab these days? There's a lot out there for patients to kind of tease through, and then also for therapists to tease through.
Definitely. And I think as a patient, it must be hard because all of a sudden Google or Facebook knows what you're searching, and then all these ads pop up.
Yeah.
And it's hard to filter through what you're looking for. I had found out about the IpsiHand and just reached out to you to get some more information. I stay up to date just by reading AOTA magazine, but even more than that, I have a Google Scholar like alert set for buzzwords, so stroke and hemiplegia, and then so I just get sent all the articles weekly, and I peruse them and click on the different technologies, check out the research, and then I'll reach out to the companies and just set up different in-services because I don't want to feel like my client or patient is not making progress because of something I don't know about. So that really drives me to keep learning and digging. And, you are such a joy to work with and so easy to get a hold of. It's not like you're calling a 1-800 line,
Right.
so you get so much more information quicker and you stay up to date. So I just feel like it's part of my job. It's also part of the culture here at Marquette, and it's really important to me to keep. I'm asking my patients to do a lot, so I need to make sure that I'm doing a lot too to support their recovery.
So let's talk about the IpsiHand for a little bit. So Marquette University had the IpsiHand upper extremity rehab system at the clinic for use in direct patient care in early 2023, when we were interested in how facilities and rehab clinics wanted to use it and how it could just be incorporated into different care models. So I was interested to know, what are some of the benefits that you saw IpsiHand provide for the time that your patients were able to use it in care?
Well, I felt that the device is unlike any other on the market because it is. And I felt that it supplemented my care in a way that there just isn't any other way to do it within therapy. The concept of the Ipsy hand being a motor priming device, but also a device that can promote recovery and rehabilitation of the upper extremity is really encouraging. So the whole concept of we need thousands of reps, well, to achieve neuroplasticity, that helps to support it, but it also provides this motor priming device that can help the patient thereafter within the OT session. So I really enjoyed the motor priming aspect of it, the action observation aspect of it, the attention that the patient had to give to just attend to their upper extremity, but also to their thoughts. So I think that was huge because really thinking for that long, it sounds simple, it was exhausting for people. And I don't think you get that when they're doing action observation or mental practice because their thoughts can wander off. For the Ipsy hand, they have to be driving the movement of the orthosis with their thoughts. So if you're not doing it, it's not reaching it, and you're getting that immediate feedback that you're not getting with mental practice, action observation, left right discrimination, all of those activities. So I think it was a really needed component. I did see improvements in motor functions, specifically with digit extension. I saw improvements in general attention and cognition. And thereafter, when the patient was performing the activities, I saw improvements in their hand function within the session.
Wonderful. Would
Mhm.
you have liked the IpsiHand to go home with each of your patients so that they could use it on a regular basis to support all the efforts that you're doing in the clinic?
I think that would have been huge if we could have had something set up where they had a home device and they were doing it for an hour before OT sessions or having the consistency to do it 7 days a week. I would be really excited to see the potential gains with that dosage coupled with occupational therapy within the clinic. So I think a home device would be an
Yeah.
awesome option for a lot of people.
Yeah, and that's the direction Neurutions is headed. The IpsiHand upper extremity rehabilitation system is commercially available. It's home friendly. So if you as a therapist thought that this would be a good fit for your individual, all you have to do is go to our website and then have your patient sign up for a time to speak with one of our Neurutions experts on the IpsiHand. We'll provide product education, but we'll also vet the individual out to make sure that it's a good fit, that they qualify. We want to make sure that it's going to be useful for them, of course, and we want our individuals that are using it to be as successful as possible before it goes to the home. So that's very, very important to us. And just as another note, our Neurutions team does support every user as they're using it at home. So we can actually monitor each individual remotely. In fact, if you wanted to, as a healthcare professional, and the individual had given you permission for access, you could monitor their metrics and how often they're using it, right down to the time of day they use it. So lots of ways to incorporate the device at home. Just wondering, how did you like working with the Neurutions team?
I thought, Emily, you were an absolute joy to work with, and I know I tell you and your team this all the time, extremely knowledgeable about neuro rehab, very specifically occupational therapy and upper extremity rehabilitation. I also found the tech support to be extremely supportive because our patient would be using it and maybe a problem would occur. We'd call, they'd have it fixed within the hour session. So it was the support team and Neurutions as a whole was super available, flexible, and adaptable within our patients. I also think that the shipping of the device and just setting up the collaboration within the clinic was extremely helpful. And it was exciting that you guys were willing to kind of partner with a clinic that you did not have direct experience with and trust us with it and allow access to a different group of clients that might not have had it regardless.
Awesome. Well, thank you for that. And we absolutely love you, Rose. We love Marquette Neuro Recovery Clinic. I remember all the individuals I worked with there myself when I was there about a year ago. So I hope they are doing well. And at Neurutions, we continue to want to be your cheerleaders and cheerleaders for all the patients that you serve on a day-to-day basis. So we cannot thank you enough for agreeing to talk to us today and sharing a little insight about your experience being an occupational therapist. Of course, might be biased, but I love our profession, and being that April coming up is Occupational Therapy Month, I just want to say to all the occupational therapists out there, you do a wonderful job. And if you want to know a little bit more about Neurutions and the IpsiHand, I'm here to help. All you have to do is go to info@neurutions.com and reach out to us with any inquiry that you have, be it a patient that you're wondering if this would work for them, or if you want a clinical in-service. Absolutely, I'm happy to do that. So thank you again, Rose. So nice seeing you, and take care.